Hi, everyone. I'm Raj with SickBay. SickBay is software that lives inside the hospital and collects and delivers physiologic data at scale. My team goes out in the field and talks to clients and users about how they can make the most use out of this novel data set. Today, we're going to spend a little bit of time with my colleague, Mishan, who's going to chat a bit about her experiences in the healthcare system and where SickBay could have been really useful. Thanks for joining us today, Mishan.
Good morning.
So I understand that you recently had a family member go through a bit of healthcare. Can you talk about that?
Absolutely. So in 2023, my 43-year-old husband was diagnosed with a myxoma. I didn't know what a myxoma was. I'm sure a lot of people don't, but it's actually a tumor inside the heart. And it goes to a lot about why I work at this company. It was really, really hard on our family. I was doing something else before, and here I am working in healthcare technology for 20 plus years at this point. And I go through this experience where I'm a family member. My husband is diagnosed with this terrible thing. He gets diagnosed on a Wednesday and he's in surgery the next Wednesday. He had a full open heart procedure. The myxoma was attached to his septum wall. So they had to, rebuild, right? And reattach and take the tumor out. And, the surgeon comes to me after I think it was 8 hours of surgery at this point. He comes to me and he says, the tumor was so big, it was kind of coming out of my hands when I took it out. It was that large. He said, I don't know if it was weeks. I don't know if it would have been months, but he was this close. And we had it diagnosed just on a whim, right? He was tired and he just couldn't get up that day. And we said, you know what? Let's go to the emergency room, because all other indications were good. He was healthy otherwise. No one would have known. So fast forward, they do this miraculous surgery. And I'm so grateful to that hospital because they saved him. The ED doc, right, saw it in a chest x-ray that fluid was backing up into his lungs. The surgeon at that hospital, it took this out and put him back together so well, and he's doing great today. But in the step-down unit, after ICU, there was a kind of a funky medication combo. And again, it was just to treat kind of how he was doing and symptoms, that he was experiencing. And it was during COVID. And I think you remember during that time, it's not that caregivers didn't want to be in that room. They couldn't be in that room. There were not enough of them. And there still are not enough clinicians today. So here I am, right, working in healthcare technology all of these years. Here's my husband who's getting better and better every day, right, in front of me. And all of a sudden, he sits up in bed and starts clutching his heart. And because of just how long we'd been there and how many days it'd been, I was immune to those alarms going off. And I've worked in this space for so long. I don't know how long those alarms had been going off. It could have been seconds, minutes, I don't remember. But all of a sudden, I see him clutching. I look up at the monitor, and he had a pacemaker that was set at 40 for his heart rate. And his heart rate had gone up to 280 like that. And I remember his oxygen is just plummeting and his heart rate is, like this, gone up to 280. And I go to the nurse call that I sold that hospital, and I press it. In my previous life, that's what I did all of those years, is sell nurse call systems and teach hospitals how to use them and set them up. And I go to press it and it goes to voicemail. Again, not because they didn't want to answer that call, but because there were not enough clinicians and they were helping other patients at that time that were also, we're in a step-down unit, cardiac step-down unit. So my heart is pounding. It's I'm sad, right, that it didn't work for me in the moment that I needed it most. And so I go out to the hall and my hand is on the code blue button, which I also sold at hospital. And I know exactly what happens when you press that code blue button. And I start screaming down the hallway for help. And it was probably 30, 45 seconds until somebody heard me and started running. They came in, they started talking about boluses, and then there was another bolus, again, these are terms I don't understand as a family member, even working in this industry, but they did everything they could. And today he's doing great because they saved him for the second time. So really the third time. I will always be grateful to that hospital, but knowing if that hospital had had sickbay, and now I'm really understanding what sickbay does, they would have seen the indications of his deterioration well in advance, because there were small changes that would show in sickbay that nobody can pick up unless you really have all the data in front of you. So when I think about if I wasn't in that room, what would have happened, it frightens me to no end. And I think about every family member that goes into a hospital every day, and you're really there as that third set of eyes on that patient, when in reality, we need something watching all of that data and helping our clinicians analyze it if they can't be in that room with that patient. So grateful to be here.
Oh my goodness. What a story. Everybody at some point, right, is likely to, end up in a situation like this, either from themselves or for a family member. And I think going through what you were going through and recognizing the idea that these are experts, they take incredible care of everybody who walks through the door. And there's only so many of them. And so it's really important to make sure that they have the technology systems, whatever they might be, that give them the most, multiplies their effect the most as possible, right, is key. And it's only going to become more key, right, as patients become more complex, as more patients go into these hospitals. I really appreciate you telling this story, and especially this journey, right, from catching it right on time to having this incredible amount of care to the long recovery period, and it's still being wobbly during that recovery period, yeah, and how he still needs to be watched over, and how important that is.
That's right.
So I can completely understand why an experience like that just brings you into, okay, what can I do to help, right? Like, what are my skill sets? How can I help improve this kind of situation and make sure everybody gets better care?
Absolutely. Because the technology exists, right? It's there. We can use it for so many different things, and knowing that it's available, it just gets me out of bed every day to make sure that no other family member goes through what I went through.
Yeah. Thank you for sharing this story. If you out there are interested in learning more about sickbay, or if you're a user of sickbay and you'd like to tell your story, please drop us a line. We'd love to hear from you. Until then, thank you, and we'll see you next time.